Got it? Yes?
Yes.
Okay. So hi, my name is Vanessa Barca.
I'm Elena Trujillo Varela.
I'm Esmeralda Barragan.
I'm Aileen Mamaraglo.
And I'm Saliha Nasser.
And our innovation is called the Chronic Solution. So we're first going to go over the introduction. We're going to continue on by going on to some background content, move on to some program proposal, and end with the conclusion. So for our introduction, as you may know, diabetes is a chronic disease that affects millions of people throughout the US. In order to combat this, many innovations have been made, including a new innovation of a fake pancreas. Although it is still in production, our team realized that more can be done to make this fake pancreas even more effective and convenient. After some thoughtful thinking, our team wanted to innovate this fake pancreas to not only help those with diabetes, but also with other chronic diseases, including hypertension, heart disease, and arthritis. In addition to these various medications and chronic diseases, vitamins and minerals will also be distributed throughout the body. This innovation is aimed at and targeted for those who are over the age of 65. We thought this will be the most helpful for this age group, considering that they are more likely to have chronic diseases and be more forgetful. So some background information.
So I'm going to go over some brief background information about the chronic conditions we are trying to address. So the prevalence of diabetes for those 65 and older remains high, with 14.3 million seniors in 2018. Current treatment includes taking insulin shots to treat high glucose levels. And then we found 103 million Americans have hypertension, and it's projected to increase. Current treatment includes blood pressure monitoring, medication, physical activity, and diet. For heart disease, we found that it's the #1 leading cause of death in the United States in 2017 at 647,457, and it causes 1 in 4 deaths. Current treatment includes living healthy and taking medication as prescribed. For arthritis, we found that the prevalence is over 3 million cases per year, and current treatment includes physical therapy and painkillers. Now we're going to be talking about the service proposal.
So first, we're going to talk about diabetes. So this device will take away the main pain point of pricking fingers to check blood glucose levels. So when someone has diabetes, a person will continuously check their glucose levels to ensure that they are at stable levels. This device will take away that by having the device monitor blood glucose levels and alert the user when there is a drastic change. If levels are too high, the users will receive a notification via the app, and the appropriate amount of insulin will be deposited to the body. On the other hand, if it's too low, the user will also receive a notification, and appropriate options of what can be eaten will be provided to them.
So now I'm going to be talking about hypertension. People who have hypertension have to constantly check their blood pressure to make sure it's not too high. This innovation will make it easier for individuals to monitor their blood pressure. The implanted device is connected to an app, and it will be able to measure the blood pressure of the person who uses it. Anyone who gets the device implanted will be able to check their blood pressure at any moment on the app. If the individual's blood pressure gets too high, they will get an alert on their phone from the app that is connected to the implanted device. The app will also have a diet plan for people to be able to lower their blood pressure. And people who use the device will be able to see their blood pressure levels from previous days so that they can have a record of it and so that they can make sure that they're making progress. Now we're going to be talking about heart disease.
Thank you, Salia. As you may know, cardiac disease comes in many forms, the most common being coronary artery disease. One of the risk factors that can lead to heart disease is hypertension. Hypertension and cardiac disease are closely linked together, and with our device and app, it will be essentially effortless for patients to be on top of their medications and monitor their disease. Medications that will be provided for cardiac disease patients will range from the medications in these categories: antiplatelet agents and dual antiplatelet therapy, lowering cholesterol, anticoagulants, receptor blockers or inhibitors, beta blockers, calcium channel blockers, diuretics, and vasodilators, among others. It's obvious that there are various medications that a patient with cardiac disease can take. However, our innovation will be specifically engineered and tailored directly to each patient, only dispensing the medication that they need and are taking. My grandmother, for example, has coronary artery disease, among other chronic conditions that she's been diagnosed with. The types of medication that would be administered to her with this device would be aspirin, Plavix, and simvastatin, as well as other medications that she needs from her other chronic diseases that she has. As of now, my grandmother has to order Plavix medication from another country because even with her insurance, the copayment of Plavix costs about $70 out of pocket each month. My grandmother has been retired for a while now and doesn't receive enough money from Social Security to afford that plus her other expenses. With our innovation, my grandmother and other patients with chronic diseases would only have to make a one-time payment yearly for all of their medications to be dispensed daily. Now I'm going to pass on to Maylene.
Awesome, thank you. So with arthritis, it's a chronic for those who do not know, it's a chronic condition with the inflammation of one or more joints that causes pain and stiffness that continues to worsen throughout age. Different types of arthritis comes from like the causes of these joints, like wear and tears, infections, and other underlying diseases. And it also causes stiffness as well. Other symptoms include pain, swelling, reduced range of motion, and stiffness. Yes. And since there is a disease that impacts over 3 million people per year with no really cure once you have it, this device will continue to monitor the pain levels of those with arthritis and keep track of the medication and killers for those who are for older individuals as a replacement of physical therapy and surgery to reduce symptoms and other types of painkillers as well. Now I'll hand it off to the next person to talk about vitamins and supplements.
Thank you, Mylene. So for the operation for vitamin supplements, the pump system or artificial pancreas, it will be connected to an app. The device will be able to administer automatically the vitamins and supplements based on the doctor request. The vitamins and supplements can be upgraded based on the lab results or doctor's order. So it will help those who have chronic anemia, low immune systems, or vitamin deficiency. Also, the app will have dosage information and doctor's recommendations throughout the app, and the doctor can make any changes throughout the app as well. Now I'm going to pass on to Vanessa that is going to talk about targeting.
Thank you, Esmeralda. So once the device has been developed and tested, the program director will begin to reach out to the various hospitals and organizations. Advertisements for the device will also begin shortly after it's been developed. We want to reach out to as many hospitals as possible to ensure that we reach as many people who are over the age of 65. So when at least 2 different partnerships have been established, distribution will begin. Doctors and physicians will begin to target those who are over the age of 65 specifically, and to make sure that everything is working properly, participants will need to conduct checkups and report anything to the doctors, who will then contact the program so that changes can be made so their lives can be changed in a better way. Talking about financing with Maylene.
Awesome, thank you. So with our device innovation, the approximate cost for one innovation like an artificial pancreas would approximately cost around $700,000 for one device. And if we made 10 throughout the year, that will accumulate to about $70,000 in total. For the app development, for staffing, for engineers and developers, it will cost approximately around $70,000 for one staff member. And if we had 10 workers on this project, it will add up to over $700,000 per year. And with additional advertisement and partnerships with hospitals and television outlets, that will cost around $5,000 a month with over $60,000 per year for 12 months. And that will approximately add up to over $830 for this project, which is under the $1 million budget that we have. And it allows us room to grow and adapt to whatever additional resources we may need for this project as well. Now I'll hand it off to Elena, who will talk about staffing.
Thanks, Maylene. The first part for staffing our innovation would be to recruit a project director. This project director will oversee our project, ensuring that every idea and change that is proposed will need to go through them before it is approved. Next, we will need to find biomedical engineers to design our innovation and address the details of how the medications will be released into the bloodstream when needed. We also need doctors to perform this non-invasive surgery. Doctors and hospital staff will work alongside us to help introduce our product to patients so that they will find out about this innovation and make the right choice in buying our product. Specialists in different chronic diseases would need to be hired, overseeing our innovation and ensuring that our implant is dispensing the right dosage of medication. As for our company that will accompany the implanted device, we will need app developers to help sync the information from the implanted device onto the app. These app developers will constantly work to update the app when changes are needed and will provide more information and features on the app as our innovation evolves. The marketing team that we will hire will help to spread the word about our device to future clients. Our focus population are individuals who are 65 and above, so we would need to advertise on platforms that this demographic uses daily. Our marketing team would focus eye-catching advertisements on TV, for example, specific channels like TV Land or Hallmark, because this population is more inclined to watch these channels than they are, say, MTV. We would also advertise on new channels, make phone call advertisements, and have advertisements on the radio as well. The last of our staffing would be to hire nutritionists and dietitians. These individuals would be working with clients through the app in real time, helping individuals who want to maximize our innovation by not just having the implant, but also changing their diet and striving to transform themselves. As for incomes, we have designed our innovation to be accessible to any individual who has chronic diseases. Our innovation is non-invasive and is focused towards older individuals who may oftentimes forget medication that is critical to their health. Even though our innovation is focused more towards older adults, any individual is eligible for our device as long as they are diagnosed with a chronic condition. Our implant allows customers to invest in a device that dispenses their medication for an entire year. This is essentially eliminating monthly medication bills. It replaces injections. The customer no longer needs to take the time to reorder medication with their doctor or pharmacy. There is no more waiting in long pharmacy lines as well. Our innovation is eco-friendly, and it will be replacing disposable containers that medication is traditionally administered in. The device that they will have will be able to be refilled with medications each year when needed. And as I said, this will be able to replace the plastic disposable containers. We are hoping that our device will essentially redefine chronic disease medication for future generations. Next, I'm going to be handing off to Esmeralda.
Thank you, Vanessa. So let's remember that this innovation will improve the well-being of individuals that suffer from different chronic disease, can give a better quality of life with less side effects and pain, and we will target towards people who are over the age of 65 and have multiple chronic conditions. This will include nutrition, dietitians, and we'll be able to give a stronger support system to patients. As well as we're going to be able to track their blood pressure, and we'll be able to see their blood pressure from previous days to make sure that they are making progress. Personalized diet that will help lower their blood pressure and have a healthy lifestyle. Lastly, this artificial pancreas will automatically administer insulin, different types of medications, and vitamins and supplements. This is our end of our presentations. I hope you guys enjoy it. This is a reference. Thank you.